Today we're down at the Vancouver Convention Centre doing paper mock-ups. So this is where we take the design and where PCL prints it for us on a 1-to-1 scale, so we can walk around the rooms and actually see what it feels like and where does the equipment go.
We're doing paper mock-ups because we're at the initial stage of design, so it's really giving us the opportunity to stand in the space and kind of get a good sense of where the layout might be. It gives us an opportunity to decide what needs to be there, what doesn't need to be there, without having to look at the added cost if we had made it into an actual room.
We want to make sure that we're figuring out if room designs are going to work well really early on in the design process before we get too far along. But they're a simulation technique, and you can bring users in and run scenarios, run simulations, and make sure that the space is really functional for the work that's going to be done in that room. We'll have people here from facilities, allied health, obviously clinicians and nurses, but a real broad selection because we're all going to be working in these spaces. Other participants include infection and prevention control, professional practice.
Everybody sort of comes down and collaborates around the space, so it's a really sort of dynamic and fun environment where we talk about, okay, where are our patients in this space and how are we going to move around? What are the flows like? Where does our equipment sit? In this case, when we're talking about a standard exam room, one of our really important concepts when we were thinking about integration and collaboration in outpatient care, a zone for interprofessional collaboration was really, really important for the design.
The feedback's actually been really positive, which I'm excited about. The mock-up gave them the opportunity to really stand inside the room.
Feedback comes in about whether it's the location of where you might wash your hands or how equipment booms might need to be placed.
Users really prefer modular, movable equipment and benching and work surfaces, and really are not that interested in millwork and having things tucked down or bolted down. So the more flexible we can be with how we furnish the room and how we position things in the room, the better. So that's a major theme of conversation. The other major theme is around safety. So we have lots of conversation around, obviously, infection and prevention control. So the rooms there's a real focus on how do we keep our employees and our patients and everybody safe in the space. So, and that goes for ergonomics, as well as hand hygiene sinks and where they are in the space or at the entrance to the space.
Once we got to the paper mock-up, we really quickly realized that if this is where the physician workstation was, and that corridor over there is where your physician might be coming from, that the patient would have to walk past all of this physician workroom space in order to get to the exam table. So in our session today, we made some changes, and now have made adjustments to the position of the provider door. We anticipate that you would be able to then greet your patient, sit down at your workstation, and your exam table will be across the way.
The resuscitation room was a great example of, we walked in the space and we immediately went, the doors aren't big enough. So we had the opportunity to say, can we expand it? And then in expanding it, what are we going to give up? So it gave us a really good back and forth discussion with PCL, or the architectural firm.
One of our team members has been walking around holding a virtual robot filming, so if people can't physically be here, they can see everything that's happening, and we can gain consensus at that moment, feed it back to PCL, see how the rooms look, and then at our next user group meeting with them, see how the changes that we've made have played out within the design.
It's been a real privilege to be able to actually come safely to a space and collaborate, but there's been this free exchange of information, ideas with PCL and our employees and the project people that has really been magic and frankly just a lot of fun.